Good evening, ladies and gentlemen. You are joining with iMed on ChannelEye. For those viewers who are not aware of what's the content of this program is, on iMed we discuss about communicable and also non-communicable diseases when it comes to the human body and how you can survive and also overcome these complications when you have them. Skin being one of the most, I think the biggest organ of the body is not just about looking good and looking fit, but it's also acts as a barrier when it comes to interacting with the outside world, with the environment. So today you will learn all this because we have invited the guest to the studio, a health professional, to speak about this about a specific condition called the eczema and how you can overcome and to prevent it at the same time. So we'd like welcome Dr. Nisansala Nagodavithana, consultant dermatologist, attached to the Sir John Kothawala Defence University Hospital as well.
Thank you very much.
And so, doctor, when it comes to eczema, what this word is, although the condition might be quite common among everybody, what would be the definition of this disease?
Well, eczema is more like a general term for a disease that usually is it's associated with inflammation of the skin, whereby it manifests as essentially an itchy rash on the skin.
Right.
So it could be like very severe, or it could presentation which sort of alarms the patient, where the patient gets very itching of the skin, followed by scratch marks, sometimes with bleeding, and there's oozing, and certainly a very distressing situation for the patient as well as the caretakers. And over the time this can grumble on, and it tends to become, the skin tends to become more thickened and more pigmented, and essentially the patients, it's a battle for the patient. So it is something that plays a huge, which has a huge impact on the patient's quality of life.
So the condition, as you said, is actually something that's that makes the patient battle.
Exactly.
So in what sense? Because is it the pain that's uncontrollable, or is it something else? Like, is it visually sort of disturbing?
Both, yes. So firstly, the disease itself. Now the patient is, imagine a student who has to be scratching all the time during his work, so he can't pay attention to his school work, and also if he starts scratching towards the night, he doesn't get enough sleep, so he becomes irritable the next day, grumpy, and sleepy in the classroom. So the teacher would be like, why is he not concentrating, whereas the root cause may be eczema. And also now imagine, like, there is a lot of social stigma still, although people know this is not a contagious disease, but sometimes they may not, his mates may not like to sit near a child with active disease. And also especially young adolescents, teenagers, they have this skin plays a huge impact, you know, on their image. So somebody with this chronic disabling, I could say actually disabling when it's very chronic, so they may not like to go out and face the world, so it might have a deep psychological impact on the patient's life. So it's broadly, it's something that can affect, as I said before, the patient, the parents, the caretakers, as well as and also the other thing is, if the patient has been applying different, say if he has to apply a lot of medication, that itself may become a burden to him. So we need to think about all these factors when we treat a patient with eczema. Okay.
Now, doctor, you also keep on mentioning children. Is it common in children, or is it uncommon?
Well, yes, it is common in children. So usually children from even as small as 3 months of age can get eczema, and it can progress throughout the childhood, and then usually the childhood eczema tends to become better with by teenage and that adulthood, which is a good news. And but even adults get eczema, so this all the age range can get affected, but quite common in children. Yes.
Okay. Right. So, doctor, you also mentioned this fact that now it gets better when you're in the teenage. So this makes me wonder. Now there could be parents who might be having this, whose children might be having this condition. Maybe the babies out there. So they look at their baby's this condition, and then they now, as you mentioned, it gets better when they're in the teenage. So it's not something that exacerbates just because of the dust or the uncleanliness. How is it like?
Well, actually, it's a quite complex disease. It has the patient factors as well as environmental factors coming into play. So certainly, it has a very important and genetic component to it. For example, if both your parents or one parent having this eczema or related atopic condition, what we mean by atopic condition is that asthma, hay fever, runny nose and runny eyes, itchy eyes they may have in the mornings. So these and also very dry skin, as we call ichthysis. So all these conditions may be there in these patients. So these patients are more prone to develop eczema. And also, if they are in a very dry environment, say in a less humid environment, and also out in some patients, the sweating and very high temperatures can worsen the eczema because of the sweating and constant irritation and itching. And also infections on the skin. It could be the skin, as even you correctly mentioned, there's a problem with the barrier. So the microorganism can invade the skin very easily and sort of thrive on this disease ill skin, and that in turn can worsen eczema. At the same time, we do see that if they get some unrelated infection, even that can worsen eczema. So it's a very complex situation where the patient, the genetic and immunological and environmental factors all come to play.
Right. So you mentioned about the parents. It can pass on. It could pass on from a parent to the children. Now imagine a parent who might be watching who is already infected with this disease. Is there a way that he or she could stop this from going onto their children genetically?
Well, unfortunately, you cannot prevent it, genetically passing on to your sibling. But it doesn't have. You don't have to worry. Look, I have eczema, but my child is going to have like that. Simply because that it's a very common disease, and patients. It's not the end of the world. There are effective treatments. So we just tell these patients, because sometimes they might ask, can I cure this? But simply, if they have a genetic factor, it becomes difficult to cure it, but we can control it effectively.
Okay, right. There's also this question now. A person who might be suffering from this disease, people might think, someone who is maybe working with them, or someone who might be at school or the university with them might be having this condition. In what way do you think a person who does not have it should communicate or behave with the person? Because there's so much of stigma, like you mentioned. People might think, whenever you see a disease, they might, people just get away, especially when it comes to a skin disorder, because nobody likes to blemish their skins. So how would you suggest that people should communicate with some person like that? Because the stigma is sort of thriving.
Exactly. The education is the key. I think there should be public sort of awareness that this is an eczema. This is, it's a part of, it's not something contagious. You won't get it by touching that patient. And also, it's important for us to be, even the general public, be aware about common skin disorders. As I mentioned, it's a common thing. So maybe they will get, one of their family members would get affected. So that, and if you get somebody, you do have somebody, then be supportive, in the sense that just that if you just provide support, like be understanding and not it's like common sense, not really probe into the disease and like treatments.
Of course, just to just at least by verbally just encourage the person. Right. So when it comes to the longevity of this disease, do you think this is a disease that would come, just surface when they are a child, when a person is a child, and then diminish somewhere on the teenage, as you mentioned? Will it come back again if you don't treat it properly?
Yeah, it tends to come in certain people. I mean, it's many patients, even though you're fully clear. If you are again exposed to that harsh environmental factors that I mentioned, it can come back, yes. But usually they tend to develop more less severe disease. Sometimes it can come up as just some coin-shaped areas of itchy skin, and it may not be as severe as they experienced in their childhood. So overall, I mean, whenever you see a doctor, we educate them regarding the general skin care as well as the specific skin treatment. So this general skin care will continue throughout their life. That will help to sort of stay away from eczema.
So hygiene is important.
Exactly. Yeah, definitely.
Yes. And when it comes to living in a condition like you mentioned, dry, cold weather, you said it can also exacerbate. And also at the same time, if you're in a very humid environment, in a hot environment at the same time, that can also worsen the scenario. So then what's the perfect condition to be in? Yeah,
now basically what happens is the skin, essentially there's a problem with the skin barrier. So when there's a barrier disruption, there is a problem. Now the skin cannot keep the things that belong inside. For example, the moisture and the inside the healthy environment, safe from the outside. So things from the outside can come in quite as easily because of the barrier dysfunction. So for example, if this is a very dry, say even an air conditioned environment, if the patient is constantly working in such an environment, or in the winter, especially in other countries, the skin tends to lose a lot of moisture because of the barrier dysfunction. And also in eczema, there's a reduced production of natural moisturizing factors on the skin as well. So that's why the very dry conditions can dry up the skin more, which will induce scratching. And then there is a vicious cycle called scratch itch cycle. You scratch, you damage, it'll itch more. So you will go on doing it, and then eczema will get worse. When it's quite hot and humid, as in most of our environmental conditions, then you will sweat more. Even a normal person with healthy skin will itch and scratch more when they are sweating. So again, the same itch scratch cycle go on. And also where there will be more microorganisms when they are sweating, and you it'll be then they are more prone to develop secondary infection.
Right. So I would wonder now, when it comes to the you said to go to a doctor as soon as you can, as long as you can detect it. But then again, how to detect what are the symptoms you might be getting? Itchiness?
Yes, first and foremost is the itching on the skin. That's a cardinal symptom, we say, of eczema. And then they develop scaling, and also you might notice the patient may be alarmed. They might even not realize and develop bleeding spots on the skin due to scratching. Right? And then anyway, it's very, although even the area may be very small, it's quite distressing. So they do usually seek out treatment early. First, they might present to their general practitioner who can sort of treat. But if it's not getting better, or if they are getting more extensive disease, then it's time to for them to see a dermatologist. There are dermatology clinics everywhere in the island at the moment, even in base hospitals. So the access is not difficult. So I think it's the earlier you treat, the earlier you educate yourself, your family, and then about the disease. Then it's easy battle thereon.
Right. So now we can combine two complications at the same time. We can also speak about eczema and then also having diabetes. Now, having diabetes and having a wound on your skin is actually sort of a very alarming situation. So what kind of a treatment and what kind of a process and what kind of a prevention method can someone with diabetes should have when it comes to eczema?
Well, so as you said, correctly said, a person with diabetes is prone to many complications. It may not directly be related to the skin only, but diabetics, if they have very good control and all that, as with any complications, they are safe. But if they have broken skin and chronic eczema, especially the other thing we commonly see is when they have this problem in their feet. So when the feet is constant, commonly we wear open shoes, so we are constantly in contact with soil and the microorganisms. So these bacteria can and yeast can enter skin easily, can break down the skin, and even through the wounds of eczema they can enter, and they can cause. The commonest presentation we see is the skin and soft tissue infection. Especially they'll come with swelling of their limb, leg swelling and pain. They might be having fever. They might have their the lymph glands on the legs maybe swollen. So they feel general ill health. So especially those people need to be, I think, in diabetic treatment. One of our main aim is to educate the patient regarding diabetic foot care and their skin care.
Right.
So that also should come along, and then if the patients who already have eczema, they should be more careful.
Right. Okay. So based on your experience and your expertise on this subject, now looking at eczema patients here in Sri Lanka, mostly because if we limit our program to our conditions here in Sri Lanka, steamy and sort of hot at the same time, where do they do? You mentioned about the feet, but on the body, what are the other areas that you have seen this most prevalent?
Yeah. So commonly now it's a little bit strange. This is that the presentation where it involves can change according to the age group. In very small babies, it can come on the cheeks and then the extensive aspect of the limbs and all. But when they are in the toddlerhood and school going age, it can come in the flexural areas. That means the elbows and in front of elbows, behind the knees, and in the elderly people, commonly this comes in the legs, especially around the ankles. They can come with, sometimes these people may have concomitant varicose veins, so they'll come with a varicose eczema. And also this, especially in and also this can come anywhere in the body, as in sort of coin-shaped areas. That's also a common presentation in adulthood. And also hand eczemas we see commonly now these days. Of course, we use more sanitizers and cleaning, harsh chemicals, and skin tends to dry more. So we do see a lot of hand eczemas that could be quite debilitating when it comes to our day-to-day work, right? And also it can occur, as I said, it can occur in feet. And so those are the common sort of presentations that we see.
Right. There's also this myth about these hand sanitizers and usage of moisturizer at the same time against, I don't know if it's a myth, but it's up to you to prove it or not. So when it comes to hand sanitizers and also hand moisturizers, do they exacerbate the eczema if somebody has it on their hands? Moisturizers.
Well, now there's two things. Like if I first say about the hand sanitizer. So now what happens is the things with alcohol. Now you know that some of the hand sanitizers have alcohol that sort of evaporates, and that's the method they act. When they evaporate, your skin can get more drier. So sometimes we advise the patient to use something with more gel form, right? And then you talk about the moisturizers. Now usually moisturizers are very good, and actually it's one of the cornerstones in managing eczema. So but the thing is, sometimes these moisturizers may have some say preservatives or some certain chemicals ingredients that can the patient can react against. So that's when the patient somebody might say that I'm allergic to this or that. So sometimes what we do, we see these patients. So sometimes usually the greasier the moisturizer, the better in that case. Say something like
thicker.
Thicker, more petroleum jelly-like ones. They may be better because they have more occlusive properties, so that they prevent the evaporation of water. But nowadays we have more and more preparation coming that claiming to have certain properties that simulate the skin's own ingredients. So there is a huge range. So at least the simple occlusive moisturization is a sort of must for eczema patients.
Right. So I got a little bit confused there when you said now apply moisturizer, but then again moisture is also, like extreme moisture is also one of the factors that can make the condition worse, and there's also dry condition at the same time. So wouldn't applying petroleum based some sort of moisturizer on the area make it worse?
No, because as I said, there's a barrier problem. So there's a problem with the barrier. Also there's a reduction in making skin's own moisturizer. So and the skin is dry, right? So you need somehow to keep the moisturizer within. So by petroleum products, what we do is we try to occlude, it acts as an occlusive agent.
Right.
So we have several types of moisturizer. So this petroleum products act by being an occlusive agent.
So it covers everything, seals
exactly.
everything. Okay.
And there are some other products that sort of attracts water from the environment. For example, urea-based products, right? Or the names you might say urea. But still, yeah, it's in a chemical sort of urea compounded creams. They attract the moisture from the environment and keep the skin dry. So there are different ways, and also now the price also changes depending on the ingredients in there. So the idea is trying to keep the skin as much, because if we, in a patient with eczema, if we keep the skin moist, that will alleviate most of the, many of the symptoms of eczema. It will help the itching, it will help the dryness. So then on top of that only we need to apply the other anti-inflammatory medications when we are treating.
Right. Okay. So it's very important that you go and speak to a doctor when it comes to a dermatologist, when it comes to having eczema. If you have any conditions, or if you have any symptoms that might even bring that. So, doctor, lastly, can we say when it comes to managing this at home, it's true that we have to go get the consultation from a professional, of course, but then again, you can't always go to the doctor. You have to be able to manage it at home. So what kind of treatments or what kind of behavior do you suppose that a person should do, a patient should do?
Yeah, exactly. It's very important about what the patient does at home, right? So the general condition is, well, we need to make sure that the patient, the soap is a real no-no in eczema, because soap dries the skin more. So we advise the patient to use soap substitutes, right?
What could be a soap substitute?
Actually there are preparations readily available. So the cheapest one would be, it's a generic called Aqueous cream. So it's not very expensive. It's not a soap, it's like a cream. So patient, it will not lather up. You will rub it on the skin and wash it off, and the skin is, you feel it's still like a moisturized already. So soap substitutes are very important, and if you get a flare, as I said before, you need to seek treatment, because you need the anti-inflammatory preparation usually prescribed by the doctor. And certain irritants, harsh chemicals, or your whatever you come to in contact with your occupation or your day-to-day work, sometimes airborne allergens can also worsen eczema, so need to be careful. And the other thing is that you need to stick to your prescription, how the way they have advised. For example, you need to use the preparations until the eczema, the particular lesions get 100% better, and then the follow-up is quite important. So
it does get better, that's important.
Exactly. So I think sometimes if you don't know the end point, and if you don't know that I can get help and this can improve, that sort of let the patient just ignores it and just go on with the scratchy, itchy skin.
Right, so that's very important for you to know if you have eczema, because if you have it, you must definitely receive professional help, and also you should also know that it can be done with as well at the same time. So otherwise, going for the itchy condition might not be the ideal condition for you and the eczema both. Right, thank you so much, doctor, for joining in today.
So much,
and it was such a fruitful discussion when it comes to sharing knowledge with the audience out there. So we had Dr. Nisan Sala Nagadavithana, consultant dermatologist from Sekotala Defense University Hospital with us today to speak about this health condition. I will be back with more updates in the next episode as well. Have a good night.